Thank you, Mark. An American worker is injured every 7 seconds. That's about 13,000 workers per day. Employers pay almost $1 billion per week for direct workers' compensation costs. But even more disturbing is the 50% of employees who pay out of pocket for on-the-job injuries because they don't report them out of fear of being reassigned, demoted, or laid off.
A good deal of these people are going to go to emergency rooms with physical pain and they'll struggle with the financial difficulties that will linger for years. Joining us with workers' comp advice is clinical nurse specialist and ER nurse Alice Benjamin. Good morning.
Good morning.
Good morning.
How often does this happen where people present or show up at the emergency room and they've been hurt on the job?
Well, in the emergency room, I see on any given day about 10 to 15% of the people coming in with work-related injuries. Now, I know that number might sound low, but again, this is the emergency room, so we're seeing acute things. Construction worker fell 25 feet down to the ground. Someone experienced burns while they're cooking in the kitchen. So very emergent problems. But some people have problems that maybe can wait a little bit. So they actually opt to go to an urgent care or a designated place by their provider or their employer. There are some people who don't speak up about their injuries at all. And then there are a fair amount of people who don't seem to tie their injuries to what occurred to them at work, so they end up going to their primary care provider.
What are the top 5 work injuries that happen on the job?
Yes, so out of the injuries that happen at work, strains and sprains by far are probably the top ones that occur. And this generally happens. Number one place is your ankles.
Okay.
So ankles, knees, lower back, and your wrist. Also cuts and punctures, pretty self-explanatory. Contusions. So we call these hematomas. This is when the force of the injury has been so strong enough that it causes a disruption and causes bleeding into the skin. So you see bruises. And this can happen not only in tissue, but also your bones. Inflammation, swelling, redness, pain, and fractures, a disruption in your bone integrity. So fractures, by the way, are the same things as having a broken bone. So broken, fracture, they're the same thing.
And what are the causes of these types of injuries?
Well, with these injuries, I would say probably the number one cause is handling of materials, heavy lifting of boxes. It may not even boxes, could be other materials. Slips, trips, and falls. And by the way, the floor could be wet, it could be cords along the way, or you could be in a hurry trying to finish an assignment. Being struck or hit by colliding objects. Maybe you're standing somewhere and someone's moving a large object and they don't see you. Accidents with tools, so power tools. They can malfunction. And then also trauma caused by repetitive strain, and this is where people generally have a difficult time tying these two things. For, I'd say, like hairstylists, makeup artists, someone who's doing repetitive movements. So in your hands, your shoulders, and your elbows, you'll see a lot of that.
Okay, so what is the first thing that we should do if we were to be injured on the job?
So number one is your safety is top priority. So making sure that you're safe and those around you are safe and getting the medical attention you need. So if you need to go to the emergency room, go to the emergency room. If it's something that can wait a little bit, make sure you report to your supervisor that there's been an injury on work, and they may advise you to go to a certain location that handles work injuries.
Yeah, that's the thing that a lot of people don't understand about the workers' comp system. You may not be able to get reimbursed if you go see your regular doctor, right?
Absolutely, and you need to make sure that you report your injuries within 30 days. If you don't report them within 30 days, there's a likelihood that your compensation, your injury may not be covered. They might suspect there was an injury from something else, and you'll want to do that. And if it's an occupational injury like smoke or chemicals in the air, you have up to 2 years to report that.
Anything else people should know about the workers' comp system?
Know if you're covered, because not everyone is covered. So independent contractors, business owners, domestic workers like nannies and gardeners, there's a group of people who aren't covered by workers' comp insurance. So make sure you know if you're covered, and if you are someone's covered, know what you need to do ahead of time before you're in that situation. Because I think once you're injured and you're hurt, you just want to seek care. And if you don't follow the guidelines, you very well may not be covered or compensated for those things.
All right, Alice Benjamin, an emergency room RN and clinical nurse specialist. You can follow her on social media and check out her website as well, asknursealice.com. Thank you. Good to see you.
Thank you for coming in.